were talking about your dad, I want to talk about this because it's such an amazing story when you are expert in a profession and then you work for different patients and like I do for different clients, and then you work with your family, and it's not like a second cousin or something, but it's your dad, so it's like very close to heart. How does it feel?
It is a surprise, so I wasn't prepared. No, well, listen, some doctors are kind of superstitious about treating their family. For some reason, I've never been, and once we were sitting around the big table with my mom, my wife, my two kids, and even like two dogs, and I was looking at all of them, and I go like, you know what, guys? I did surgery on every single one of them, including the dogs.
Okay, so,
I mean, it was like something minor for the dogs, like I pulled few teeth. For my kids, I did their like frenectomies, their like lip tie. For my mom, it was dental implants. As a matter of fact, she was one of the very first all-on-4 patients 18-ish years ago.
Wow.
And my wife, when we met, I did crown lengthening, recontouring of her gummy smile, and we did 10 veneers for her. So I wasn't exaggerating. So when it came to my dad, a little bit of history. I started placing implants for him in 2001. When I just started placing implants, he lost some teeth lower left, and then we were adding, and then looking back at my own treatment over the course of almost 25 years, I realized that it was totally an over-treatment. And not because my dad was my guinea pig, by no means. I was confident in what I was doing, but as he was losing teeth, we were just replacing with implants. So fast forward all those years and some bone loss around some teeth and some implants and his health issues. So a decision was made just to replace everything. But now we replaced everything in one shot, right? So instead of having those lengthy treatments on him when we would extract the tooth, do the bone grafting, come back, place the implants, restore with bridge, and then other couple teeth would fail. We just treat and plan everything like we would do for all of our patients nowadays. And the surgery was done in a couple of hours under general sedation, anesthesia. And then he spent the whole week with me. He lives in Florida. So I was the one, and of course my team who helped me, we put him in a wheelchair, put him in my car. I brought him home. By the way, it was a very good experience for me as a surgeon to know what my patients are going through, taking care of their, loved ones, family members. We tweaked certain protocols a little bit. But, he reported zero pain, and, I was very nervous, and of course he was, having some recovery after general anesthesia, and my dogs were helping him. We'll add some pictures, they're funny. You know how dogs, they feel that they need to take care of people. It was very cute. They were like staring at him in the morning, and I slept with him like next to his bed, but he was experiencing no pain, which is mind-blowing, I mean, given the magnitude of the procedure. So that was the surgery. That was a few months ago. I think it was November-ish, and then he flew back to Florida with a new set of amazing temporary teeth, which we do for all of our patients. And he came back a few weeks ago, and we delivered great-looking zirconia bridges, and pictures will be added. And evaluate for yourself.
So I'm curious now. Are you a better specialist, better doctor now after this experience, like taking your dad home and watching him from the perspective of someone who's taking care of the patient who comes from you?
The short answer is yes, because I think it's very important for any doctor to become a patient himself or herself, right? And I'm a long-time dental patient for many things, being born and raised in Eastern Europe, so I was not blessed with great teeth. But also taking care of your family member after such an extensive procedure, as I mentioned, helped us as a team and myself as a individual surgeon just to tweak certain things, certain protocols, not during the surgery, frankly speaking, but the aftercare, and like even something very basic, how to transport a person from a car to your home, right? Luckily, my dad stayed on the first floor of our house, and it was like only a few small steps, but I had to carry him from the car. Now, let's say if somebody needs to bring this person to the second floor and there is no elevator, something to really think about in advance, maybe some foldable wheelchairs or, other arrangements. And also, Anita also packs very nice aftercare post-surgical boxes for patients who undergo those procedures. And those boxes, not only they're cute, but they have like things like, some ramen, some soup, cold pads, some sling for the face, some lip balm, applesauce, and things that can be very useful. And of course, one can go and buy them, but you know how stressful it is after the procedure. So having all those in one post-surgical box, it's a very nice touch.
Yeah. So years as, of course, experience as you practice and you heal people, but then the technology, I think it's another aspect of being a better expert, right? It's like they help us a lot with technology.
No, absolutely. What I always tell my patients, and I'm completely honest about this, what I am capable of doing with my team today in our offices, we were not able to do even 2 years ago.
Wow.
Given that we're on the cutting edge of technology, we're investing heavily into new equipment, but even like today, with all this like scanning and 3D and printing and newer implants and all those things put together, without exaggeration, if I had to do my dad's case 10 years ago, it would have taken like a year easily. Now it took a few months, and after one surgery he left the office with new teeth. I mean, I don't know about you, to me it's mind-blowing.
It is. When I met you and you showed me all those cases, I was like, people really got out of your office with new teeth, like after the surgery. I mean, yeah, temporary, but like, you still look good.
Yeah, your patients are stable. I mean, they're rehabilitated socially because now they can smile, especially for people who had been struggling with damaged or missing teeth, right? They can eat healthy foods. When I say healthy, let's say somebody wants to eat a carrot. Yeah, we respectfully ask not to bite the carrot like a fresh carrot, but if it's baked or roasted or shredded, they can eat it. The same goes with protein. The same goes with like any other healthy food. I mean, of course, there are some restrictions. We don't want patients to eat like meat on the bone.
Crack the nut.
Yeah, but they, like anything they can break with the fork, they can eat. Which actually not always the case with situations that I see for dental tourism, when those providers, to be on the safe side, they don't want to risk with temporary bridges that sometimes can break, and we replace those bridges at no cost and almost no time because we just print new ones. But if the patient is in a different country, sometimes they choose protocols for the patients, are you ready, to be with no teeth at all. I mean, it sounds crazy. No, I'm not making it up. One of my sites projects pro bono, helping patients to get more educated, patients who consider dental tourism. They're heavily from Eastern Europe and post-USSR. They're like Russian speaking. I'm Russian speaking provider. And it was shocking in the beginning. I saw a lot of patients walking around for 4 months. I'm not talking about 4 weeks.
You're flying there, they place the implants, which is not a tooth, it's a screw,
It's a
right?
screw, yeah.
And you're just walking around like that?
I mean, they give you like a plastic bag with 2 removable dentures that you cannot wear because they don't fit, and everything is hurting. And then they tell you, oh, you're better off not wearing them. And because people are so stressed, etc., they just choose not to. They just wear a mask for 4 months and they walk around. Not only that, then they have to undergo another procedure to uncover those implants. It's another surgery. Nobody wants to talk about this, but we typically perform things with one surgery. Everything needs to be meticulously planned and organized. There's a lot of, like I say, homework to be done virtually without the actual patient, because after we collect all the digital data, like facial scan, optical scan, it's like instead of impressions, remember that gooey stuff that went in your mouth before, and then we merge it all together with 3D X-ray, and then we design the project, like I say, without the actual patient, because now we have the virtual model of his or her jaws, anatomy, smile, and then on the day of the procedure we just execute this plan. We remove bad teeth, we place implants, or just place implants if the teeth already were missing, and then the same very day, after a few hours of the surgery, we merge the prefabricated virtual project, and we print and we deliver screw-retained bridges on top and bottom, or only one arch, and patients leave our office. We'll add some examples, including my father's example, and it's a routine. And it's routine for us, and it's routine for, other providers who work at the same level. But, the more I research this subject, it's not always a given. I mean, you'll be surprised, but, some providers just don't deliver temporary teeth on the day of the procedure, and sometimes not even like within a few months. So it's shocking as it is.
When you just had a surgery, right, and you over there, and then you flying back, is this a factor too?
I mean, I don't want to badmouth anyone. I'll be just very critical about my own work. I've been placing implants for more than a quarter of a century. I mean, it's not like a figurative speech. I placed my first implant in 2001. And we do a lot of implants and a lot of full arch treatments. But sometimes they're like minor or sometimes major complications. Minor would be something broke, temporary, or some component is loose on an implant, and then we have to, tighten, fix it. Most of the times the patient comes and, we just make sure everything is easy to fix. We do it, reassure the patients. I am relieved and happy that it's nothing serious. Patients also happy, and they drive back home. Sometimes it's something more substantial. Let's say we have like bleeding, or we have some post-surgical pain, or, unfortunately, sometimes implants don't take. I mean, it happens too. So we would replace that implant at no cost, and we'll do it like very promptly. Now imagine if that case was done abroad, right? Now what? Now you're like hopping back on the plane and flying overseas. It's just logistically very, very challenging. And it's, let's be honest, it's not just about the money. Even if in a given country dentistry is cheaper for objective reasons, let's even give a benefit of the doubt that it's the same level of provider, which does happen. I'm doing extensive research, and I'm, interviewing those doctors and patients, and there are good providers in other countries. I mean, let's just sort out the bad ones, because those are definitely not the ones you want to go to for no matter how inexpensive it is. Because I've seen cases when young patients, like 40 years old, they had to replace 10 out of 12 implants that they received. And again, I'm not like trying to be sarcastic or celebrate others' failures, but at this point, it doesn't matter how much they cost. You have to replace everything. But even if it's a good, solid provider, and then they have a complication, which can happen, especially with those involving cases, right? Now what? Where are you going to go? We're going to seek for help in Chicago or any other part of the U.S. you're living in. So consider that, because now if you have to fly back a couple more times, given the cost of the airfare, accommodations, and quite frankly, your time. I mean, your time also has some value to it, right? Like imagine you have to skip another week of work, That's why in my case, although I could have gotten my veneers in my home city of Moscow, and I have amazing dentist friends who would have done it for me almost for no cost, I intentionally got my veneers here by very skillful prosthodontists. I'm very grateful, but given the value of my time and the necessity of treating my patients, I chose not to go to Moscow, So when you choose providers, I'm not saying that dental tourism is absolutely no. It's one of the options, but watch our other videos about like how to make those choices wisely, how to avoid the most common traps and kind of misleading information. And then once you weigh all those pros and cons, and you can reach out to us for help. I mean, we're not opposed to helping you with an advice, and hope this helps.
Perfect. So if you have any questions, if you're really considering flying out for your dental work, just
my dad flew out for his work from Florida, so it's a viable option.
Yeah, so just you can reach out to the doctor, and he will give you a fair advice. Just you have to provide probably,
just send us the X-rays. You can take pictures with your phone. We'll attach the pictures, how you can take them with your phone, like some schematic drawings. If you have any previous treatment plans, submit to us, and I promise to be as unbiased as possible. I'm at this phase of my career that I want to be a useful resource to you, no matter where you're going to choose to get your treatment from. And we have a handful of amazing providers from all over the world, from Latin America, from Central America, from Eastern Europe, from Western Europe. And I'm talking about doctors that I interviewed personally. I've seen their cases, and some of them I've known for more than 10 years, literally. So let's say if you need a doctor in Lithuania or UK, I have someone I can vouch for. If you need a doctor in Germany, no problem. In Poland, in Mexico, in Colombia, just reach out to us and we'll provide you with those options.
I'm a good example of this because you took an X-ray because I was kind of in pain and I didn't know what's going on. And you said that I think you have infection, right? And you referred me to the doctor, which was amazing. I have to tell you, like I seriously trust you because if you send me to the doctor where it was so smooth and I feel amazing, and you could have said like, hey, go whatever, or you know.
But that particular doctor, Dr. Tismansky, who is an amazing endodontist. And ironically, we became good friends after we, were introduced professionally.
Mm-hmm.
And he did 2 or 3 of my own root canals, and I was in so much pain before, and then he took care of me in no time. And
He's so fast. Oh God,
very fast, efficient, and
Yes.
After being a dentist for so many years, I can evaluate someone's professionalism. So again, there are always options on the table. It boils down to your, finances, your budget, your realistic budget for that, then your time, which is also has some value, and and your expectations. I mean, what level of outcome are you expecting to see? Are you like looking for just good solid teeth, or are you looking for some high-end dentistry? And just be realistic with all 3 of those factors, and we'll recommend someone to you, right?
Yes, and don't be afraid. They have Anita at the front desk who speak Polish. So if you have any questions in Polish, just feel free to call. So Polish, Russian.
Hablamos español.
There you go.
Right, Fabi?
Give them a call. Ask questions. They are gonna answer all of them. Thank you for watching.